Hi, this is a case presentation for internal derangement with reduction. Our patient is 27 years old male and his chief complaint, his right side jaw has pain with opening and chewing associated with sounds. His medical history reveals a motorbike accident 6 months ago. On exam, we revealed the following. On the right side, the deep master was painful, moderate, superficial, moderate pain, temporalis, mild pain, lateral condyle, moderate pain, dorsal condyle, moderate pain. Left side, the deep master, none, superficial, none, temporalis, none, lateral condyle, mild, dorsal condyle, mild. What about the opening? His maximum opening was 42 millimeter, right lateral 9 millimeter, left lateral 10 millimeter. Early noises on opening and late on closing found. We took a CBCT and the panoramic show no abnormality, no infection. What is the diagnosis? Internal derangement with reduction. Temporomandibular joint. It is the TMJ. The TMJ is the joint of the jaw. It is a bilateral synovial joint derived from two bones. Temporal, which is a part of the cranium, the mandible, and this is the free part connected to the cranium by ligaments. Contents: capsule and articular disc, ligaments, innervation, blood supply. What are the structures? 6 main components of TMJ. Number 1, mandibular condyles. Number 2, articular surface of the temporal bone. Number 3, the capsule. Number 4, articular disc. Number 5, ligaments. Number 6, lateral pterygoid muscle. What about the capsule and the articular disc are the most important part in the TMJ. The capsule, it is dense fibrous membrane that surrounds the joint and incorporates the articular eminence, which attaches to articular eminence, articular disc, neck of the mandibular condyle. What about the articular disc? Articular disc, fibrocartilaginous tissue positioned between the two bones. It has two parts, central part and peripheral part. The central area of the disc is avascular and lack of innervation. The peripheral part has both innervation and blood supply. So what about the central area? Where does it get nutrition? From the synovial fluid. Synovial fluid provides the nutrition for the avascular central area of the. What about the ligaments? Ligaments, 3 ligaments associated with TMJ. The major, it's one major, which is temporomandibular ligaments, and 2 minors. The 2 minors are the stylomandibular and the sphenomandibular. Innervation of the TMJ, only sensory innervation the TMJ, and we will talk about the proprioception as well. So the sensory comes from auriculotemporal and masseteric branches of V3 or mandibular branch of the trigeminal nerve. There is no motor innervation only for muscles. What about the proprioception? from Ruffini endings, which is static mechanoreceptors to position the mandible. We have Pacinian corpuscles, dynamic, which accelerate movement during reflexes. We have Golgi tendon organs, and they are static for protection of ligaments. And we have the free nerve endings, which provide pain receptors. Blood supply. Blood supply comes from the branches of external carotid artery, predominantly the superficial temporal branch, deep auricular artery, anterior tympanic artery, ascending pharyngeal artery, maxillary artery. What about the jaw movement? Mandible is moved primarily by four muscles of mastication: the masseter, medial pterygoid, lateral pterygoid, and temporalis, and they are all innervated by V3. So what is internal derangement with reduction? Disc is displaced anteriorly upon translation. On opening, a pop or click can be heard and usually felt. This indicates the condyle moving back onto the disc, known as reducing the joint. Upon closing, the condyle will slide off the back of the disc, hence another click, which point the condyle is posterior to the disc. Upon clenching, the condyle compresses the bilaminar area and the nerves, arteries, and veins against the temporal fossa, causing pain and inflammation. Treatment. If there is no pain, there is no treatment. If there is pain, we give the patient anti-inflammatory. We give him instruction for stretch exercises, instruction for thermal therapy, which cold or hot or both, for 10 to 15 minutes every time, 5 times a day. And some cases, severe cases, we can give TMJ splint. Back to our patient. What happened to the patient? We prescribed anti-inflammatory Motrin 400 milligram 3 times a day. Gave him thermal therapy. We taught him how to do the exercises, and we asked him to come back in 2 weeks for follow-up. Patient follow-up visit, he mentioned pain was reduced by almost 40%. We instructed him to continue on the exercises and thermal therapy and to discontinue the inflammatory. Thank you.